Next from Springfield, Jennifer Creasey of AARP talks about the coming establishment of health exchanges, where individuals will be able to shop for health care coverage that best suits their needs. She also discusses the state's plan to expand Medicaid rolls by 500,000. These changes are the result of the President's health care reform bill. This runs about 15 minutes.
Jennifer Creasey, thanks for joining us on the Illinois Chapter. There are in the legislature this spring two major changes in health care. One is the expansion of Medicaid, and the other is the establishment of health exchanges, which have not heretofore been in existence in Illinois.
Right.
Am I right in saying that both of these are somewhat of an offshoot of the Obamacare?
Yes, absolutely. It's we're trying to implement the Affordable Care Act, or Obamacare, in Illinois. Both of those were established in the Affordable Care Act and left it up to the states to specifically do so. So that's why we need legislation on each of those. Specifically regarding the Medicaid expansion, when the Supreme Court ruled that the Affordable Care Act was constitutional, they also ruled that it was up to the states to decide if they wanted to do this Medicaid expansion, or this new Medicaid program that we're calling it. So state by state, each state is going through with their own legislation to decide if they want to accept this expansion or not.
And we'll point out that, in fact, there's a number of states, even where the Republican governors are for participating,
yes.
Florida being one, where the legislature has decided they're not going to participate.
Yes, that's true. I think they're talking about a special session right now.
So here in Illinois, what is the legislation that is being moving through the system that would establish the health exchanges?
So Senate Bill 26 was sponsored by Senator Staines in the Senate, and that passed on a partisan roll call, and it's now moved to the House, where Representative Feigenholtz is the sponsor. And what it would do is it would expand the Medicaid program up to 138 of the federal poverty level and have a 100% federal match for this new Medicaid expansion.
I'm sorry, when you say 138, what does that mean?
The federal poverty level is set, so right now our Illinois Medicaid system is covered for 133% of the federal poverty level. So, and that's for a family of one, that's an income of $11,490 a year, and for a family of four, it jumps up to $23,550 a year.
$23,550. That's current law.
That's current.
And once that changed, then it would go up a bit more than that. What, closer to what, 25,000 maybe?
Yeah, maybe just a bit more. But these people right now cannot afford health insurance, and they will simply fall through the crack because they won't be able to purchase health insurance once it becomes mandatory as of next year. So that's why we really need to expand the Medicaid program.
And again, just simple, people get confused about the similar terms of Medicare and Medicaid, and
yes.
simply put Medicaid as health care payments for the poor, the system for the poor. Medicare is for the elderly.
Yeah, it's a way to think about it. Medicaid's at the state level and with the federal match, but at the state level, and then Medicare is the federal program for people over 65.
Now, for Medicaid is what we're talking about,
yes.
the establishment of health care for the poor. So this would establish at 138% of the poverty level.
Yes.
As we said, that would roughly be $25,000 for a family of four.
Uh-huh.
And what do we, one of the concerns that some people have in the state and is this where the federal government holds out a carrot, but then once the state starts doing it, the feds pull the funding away after a couple of years, and then the state's left with the bill?
Well, by law, the feds would reimburse us 100% for 3 years. Then after that, it will go down to 97%, 95%, and then it caps out at 90% federal reimbursement in 2020. Then it stays at the 90%. There was an amendment put on the bill in the Senate that said if the federal government changed their mind, if they decide not to expand Medicaid and not to reimburse the states at these high levels, then the state of Illinois, this bill will be null and void. This new Medicaid will cease to exist. So you'd need new legislation to do so. So it's already built into this law. If the feds back out, then this is a moot point.
And on the other hand, I mean, just to follow the I think the people who have concerns about the fiscal impact to the state of Illinois, even if they the feds fund it 90% down the road, there would still be 10% the state would have to be picking up.
Absolutely, but right now the state is only reimbursed at 50%, so 90 is still a lot better than 50%. And you have to remember
So
these.
can I pause for a moment,
yes,
because that's
yeah.
an important point.
Yes.
So right now on Medicaid, the state is only reimbursed for 50% of the cost. So we're paying the other 50%,
Absolutely.
which is, so if this were to become law in Illinois, and we, as Governor Quinn and the Democratic leadership, I think, I'm not sure what Senator or the House Speaker is. Do we know what Speaker Madigan?
No, we don't know yet.
If it became law, then Illinois would recover a lot more of what it is currently outlaying, because we only get 50% on the dollar, we'd get 90 cents on the dollar.
Absolutely. It would bring money into Illinois and provide about 340,000 people with health insurance that currently are not insured. These people are going to the emergency rooms. They're being covered by hospital charity care. So taxpayers' dollars are already paying for these people. That's why the Illinois Hospital Association is also very supportive of this legislation.
Do we know how much it would bring into the state? In other words, to the extent that one of the things we often hear, and it's everyone accepts these numbers more or less, we're some billions of dollars behind in making payments, and a lot of that payment is tied to healthcare providers, so that we're something like $6 to $8 billion. I don't know what the exact number is, but it's a lot that we're not catching up on. If we were getting this, first of all, in the early years, we would get 100% instead of 50%.
Yeah, we would get 100% until 2016.
So do we know how much more money, do you happen to know off the top of your head how much more money that would mean to the state? I'm wondering if that would allow Illinois to catch up on its backload of bills.
It would certainly help. It would definitely help. I think that they're still crunching the numbers right now, but for example, the uncompensated care, their Kaiser Family Foundation is estimating that the uncompensated care in Illinois would decline by $953 million. So that would help a lot of these providers that are already providing this health care for the uninsured.
So it could be as much as $1 billion.
Yes, and I can get you those
these numbers
exact
are all
numbers.
guesstimates.
Yes.
I will point out, I know just from a previous story that there was one just hospital in the Chicago area that was treating Medicaid children. And uncompensated, that one hospital, people don't realize the number of dollars involved. It cost that hospital $50 million
Yes.
in uncompensated care.
Absolutely. And that's why the hospitals are really on board with this legislation, and it would provide a great deal of help to them and their pillars of the community, and then also the people that if they have a primary health care doctor, they're not going in the emergency room when it's an emergency. They're getting the preventive services. They're going in for their yearly checkup so they can hopefully catch something before it gets too bad and where they would have to have an emergency situation, which in itself would save money to the healthcare system as a whole.
I mean, ideally, that's the way it would work, and I guess the thought process behind it that you don't wait until there some flaw becomes a major cancer, or you catch maybe a cancer early. Not only save the person's life, but you save cost on the road.
Absolutely.
We've been talking about the expansion of Medicaid. We've also mentioned the health exchanges. What is a health exchange, and that is also tied to the implementation of Obamacare?
Yeah, so under the Affordable Care Act, it is said that each state could establish a state-based exchange or marketplace. So this insurance marketplace would be a place where the people of Illinois could go and they could shop for their health insurance that would fit their individual needs. These are
now,
people,
can I interject? When we say a place they could go, are we talking about a physical place, or are we talking about going online?
It would be a website, but there also be physical navigators, people in the community that you could go to, and they could help you navigate this system. So navigate this online database marketplace where you could go and you can compare all the different plans on there and see what best fits your needs for your for the cost and what you need to be covered.
So the navigators would be trained individuals, almost like counselors. I don't know if people would use the term navigator, but they're using that term. But practically speaking, it's someone who's a counselor and would be able to say, given your needs, this might be the best plan for you.
Yeah, they're not going to tell you what plan to pick. They can't, they're not brokers.
They would advise you.
But they could just help you go through the system, and they could show you the different plans, and then you would pick what best fits your needs.
Can you change once you pick if you don't like what you picked?
Well, open enrollment will start in October, and for plans to be effective in January. So just like any
No, that's October. Open enrollment starts in October of 2013.
2013, which we didn't talk about, but for year one, Illinois is partnering with the feds, and we're going to go into a partnership exchange for year one. So open enrollment will start in October of 2013, and the plans will go into effect January of 2014. And so the partnership exchange will be for 2014. We're working on legislation now that would establish a state-based exchange so that we wouldn't have to partner with the federal government and more have a stronger Illinois state role, and the partnership exchange would then transition to the state-based exchange to be effective 2015, if that makes sense.
Mm-hmm.
So just like any insurance product like Medicare or when you have your employer, there will be an open enrollment period every year. So then you could tweak your plan then.
How is one going to prove on Medicaid? Mm-hmm. There's a lot of criticism that we have people who aren't qualified getting on the plan. Is there going to be any way of determining, A, if they're a citizen, B, if they're poverty? How do we know if they're actually poor and not making $100,000 and claiming to be poor?
They will work off of your tax return. So they'll be for all of the Medicaid, and then there's also some tax credits, some subsidies worked into the exchange, into the system. They'll go off of your income tax return. So you'll have to prove your income, prove that you're paying taxes and that you are a citizen and part of society. And that's why we need this Medicaid expansion legislation to get you into the systems, because these people don't have health care now. So there's going to be a lot of people that are jumping back and forth from Medicaid to the exchange. Incomes change every year. So for the whole puzzle to work together, we need both pieces of legislation to
And you
pass.
said there, which bears repeating.
Uh-huh.
The exchange is not just for, the exchange is for everyone,
Exchanges for everyone, specifically.
irrespective of your income.
Yes, yeah, for everyone, and it's really going to help those that are small business owners and individuals that have to shop for their own insurance. So if you have insurance through your employer, this will not affect you. But for all
could it? I mean, let's say
it could affect your employer, but it would have to be, and the details are still being worked out now.
If I'm an employer
Mm-hmm.
and I'm with XYZ insurance company now,
Uh-huh.
but I find out that ABC insurance company maybe is offering a better deal,
Yeah.
it would impact them, I suppose, if I go with ABC insurance company.
Yeah, absolutely. Yeah, it would. But a lot of this would really only affect small businesses, small employers, as well as individuals. Those are the ones that are going out into the marketplace by themselves and shopping around. The giant employers, they hit group rates and everything. They have different deals that they can work out with insurance. So that's kind of a different.
What about those small, maybe you're a pizzeria, restaurant with part-time employees? Do you have to provide health insurance for part-time employees?
No, it's full-time employees under the Affordable Care Act.
And how many employees would one have to have full-time before you cross that line where it's mandated that you have insurance for them, do you know?
I don't have that in front of me, but I think it's around 25 or 50.
Is there any compensation for a small business that may not be currently providing health care that would be mandated to have health care for employees? How would they come up with that money if they claim they don't have it?
There are tax credits that are built in to the bill. So if you do offer health insurance, you would be able to write some of it off or get different tax credits. It's kind of different formulas based on the income and the number of employees and so forth. But they will get some help to do so, because it is very important that they do provide health insurance for the employees.
And then just before we close out, the bill, and I think you said Senate Bill 26, was it?
Yes.
Is that we're coming up to the end of the legislative session at the end of May. Does that have to pass by the end of May in order for us to set up the system that would be so people could enroll in October?
Yes, it has to pass by the end of legislative session. HFS is doing a lot. They have to get their computers up and running. They have to work with the feds. There's a lot of work that needs to be done before January of next year, and really before October, before the open enrollment starts. So it's imperative that we get this passed sooner rather than later.
If people want more information, can they go to the AARP website?
Yeah, aarp.org/Illinois, or our Facebook or Twitter pages has a lot of information, and they could feel free to call our office also.
And aarp.org/Illinois, is that IL?
IL, yes, IL, excuse
IL.
me, yeah.
All right, very good. Well, Jennifer Creasey, thank you again for
Thank
joining us.
you. Thank you very much.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.